Hello, good afternoon, good morning, good evening, and welcome to episode 45. My name is Richard Ishwood. I'm a registered nurse, and my clinic is in the UK called No More Earwax. Right, have a look at this one. Really tricky this one was. Now, you might notice, some of you, if you watch a few more of these types of videos, it's a bit sideways, or it might be the wrong way up to what you used to watching these videos at. Reason for that is this lady was lying down, and the reason for that is she was bedbound. She was in a bed. It was a home visit, and if memory serves me right, I think she was actually her sight wasn't very good. If not, she might have been actually blind. So if you can imagine how much you'd rely on your hearing if you're blind, it's obviously really, really important. And this poor lady had not been able to hear for a good while. So what we've done here now, as you can see, it's extremely narrow, the entrance to her ear. The one I'm actually using there is the fine end tube. That's the smaller of the two tubes, and I did that for a couple of reasons. Firstly, it is very narrow, so it gives better visibility with the camera if you've got this really fine end. It's about it's a millimetre, by the way, the size of that. It'll look huge on there. It's absolutely tiny. It's a bit less powerful, but as well as that, it makes it a bit quieter as well. Now, I didn't want to startle this lady. Obviously, if she relies on her hearing for pretty much everything if you're blind, so any loud noises in there obviously would be quite distressing, and I didn't want to distress her at all. So I knew with the normal one it probably might come out in quite quickly with one go of this, but when you use the fine end like this, it's coming out in installments really, so I'm just gently peeling away little bits from the side. I think she uses a hearing aid as well because it is a bit smushed along the sides here. Just about start to see a little gap at the top there. Well, it's actually just to the right hand side there where you can see the bits of the eardrum now. And yeah, but it's like a sheet, this bit. I've tried to peel it away there. And it makes it really hard to get out because you need a full seal from the end of the suction tube to the wax itself, but it's actually like on a leading edge like that, coming onto it like that. But so it would be like that. So ideally you want to flatten it out a little bit to get a proper seal on it, so you can start to pull it out. And a bit of wiggling and a bit of manoeuvring, and you'll just start to see it start to flatten out, and then you can get the tube on the flat edge of it. There you go, just like that. Then you get a better seal, then you can start to pull it out. I know she's very grateful, this lady. It's pretty much restored her hearing completely. And for her age, her eardrum at the end, it looks pretty good actually. Doesn't look too bad at all. So there that one comes, and there it is. And I think she might have been in her 90s possibly. Memory's terrible. But yeah, she was certainly a good age, and eardrum looked nice and healthy afterwards. So that was the main one. The other one I'm going to show you, there's another three, and these are all really, really quick ones. Because I thought, let's just fill this out. I know you like watching longer videos. The interesting procedure, that wasn't too long, but these are fairly typical, these procedures. Not everybody comes in has a full blockage. So you've seen the first one, it literally takes seconds. And again with this one, I think it was a different patient. Stick it in, pop it out, and you get another little bit down at the bottom there. Just quickly grab that and pull that out. Now these not going to make a huge amount of difference to people's hearing, but it's more about preventing it being a problem in the near future. The kind of people who come and see me sometimes, they know they have a problem, and so they like to nip it in the bud before it gets to that point. And the third one here is just as quick as the others. Just grab it and pull it out. So yeah, three little bonus ones for you there. Hope you enjoyed those. There it is, nice and clear and shiny. So I hope you enjoyed those. Stay tuned. I'll hopefully have plenty more episodes for you this week. But for now, thanks for watching, and I'll see you later. Ta-da.